Your medical sales career is at risk, but it doesn't have to be. The industry is ridding itself of reps who don't show consistent growth. Just maintaining the business isn't good enough anymore. You grow or you go. Medical sales is more difficult due to changes in the healthcare market, such as group buying, corporate contracts, physicians becoming employees, and COVID reducing access for many medical and pharmaceutical sales reps. Now, the good news is, with all these changes, there are new sales opportunities to be exploited by those who know how to identify or create them and then influence healthcare buying decisions to close business. This means if you're in the pool of medical sales representatives who focus on customer service more than making new sales, my friend, your days are numbered. But if you know how to distinguish your products, your company, and yourself from all the noise in the industry, your best days of medical sales are ahead. The only way to win the competitive battle in medical sales is through distinction. Now, distinction, there's a buzzword you probably hear and repeat, but what does it really mean? Well, to answer that, let's look at what happened since the COVID-19 pandemic reared its freaking ugly head in February of 2020. Supplies and services in healthcare were squeezed. And we know that for doctors and other HCPs, it was no longer about having the best or preferred product. It was about having anything acceptable. Think about masks and PPE. They weren't available. They were using plastic bags, newspaper, anything they could to be able to protect themselves. But that was just the tip of the iceberg. You see, the focus now has been on caring for patients, not shopping for new products when existing products are working. Yet, medical sales representatives who have been able to distinguish their products during this time are enjoying more business than ever before. So if your sales approach is to show up and just talk about your product, guess what? Your HCP prospect already has a similar product that works. We know it works because they wouldn't be using it if it didn't work. So unless you can distinguish your product, in a significant way, you're just wasting time. The healthcare professional's time and your time. You see, your job isn't to show a product. That's what a lot of medical reps think their job is. Well, for a living, what I do is I drive around to doctors' offices and hospitals and I show my products. No, that's not your job. Your job is to distinguish your product from countless products that essentially do the same freaking thing. In other words, your job is to create distinction. Now, distinction isn't about just making your product stand out in a relevant way. It's a little bit about that, but it's really about more. It's about changing the customer's perception of the problem, understanding the problem's root cause, and then being able to position your product where it's distinctly different and a perfect fit for the HCP and the patient's needs. Now, if you don't know how to do this, it is important that you learn now. And I'm going to help you out. I have a free training course to teach you how. It's called Distinction to Dollars, Winning the Competitive Battle in Medical Sales. And again, there is no charge for this training. It's going to show you the steps to distinction right now. So to get immediate access to Distinction to Dollars, Winning the Competitive Battle in Medical Sales, go to medicalsalescourses.com. Again, that's medicalsalescourses, plural.com. I look forward to sharing with you the secrets of creating distinction in medical sales because I know what it's going to do for you, for your company, and ultimately for the healthcare professionals and the patients that they serve. I'll see you there.